Alongside that is our 3-year strategy for infection control. We are currently about to start looking at our next 5-year strategy with some focus groups. We improved our clinical governance so that everybody knew what was happening in the organisation. Some of that was around, we do a daily email, for example, number of people diagnosed with Clostridium difficile today, how many have we had for the year? How does that compare to the targets that we've been given? So that it's not just an elite few who know what's going on, it's a whole trust-wide approach. We have a weekly chief executive email update in which there's an infection control section with top news and how our hand hygiene is and other things that are happening as well. Refiguration of clinical space is, well, really we threw people out of their offices on wards and we reused the space there and made it into clinical again so we could increase our number of single rooms. We made an isolation unit for people with C. diff, and we also looked at our signage in the hospital and how that directed people to behave differently in the clinical areas of the hospital, our expectations, and also how we're doing and how people can engage who are visiting the hospital. This did go along with some increased resources for my team, which were most welcome, to facilitate the whole thing. This was one of my main resources, the lady in red here, Alison. She does what she said on the tin. She's the invasive devices nurse, and her job is to spend most of her time clinically teaching, facilitating our staff with their invasive device care. She's also put together with the staff the most appropriate documentation for them to monitor care, because paperwork on the wards is a challenge. So we try to reduce it as much as possible. But this was developed with our staff to make it as easy as possible for them to get things right and be able to hand over from shift to shift. This is an example of some of our signage. This is at every main entrance to the hospital. These are freestanding boards that we can change the notices in them as suits. There's also a range of leaflets for staff and patients. If we have an outbreak, that's the yellow one in the middle. Do not visit such and such a ward, please. We've also replicated this as a wall board in all our outpatients areas with a view to publishing, for example, surgical site infection data for patients who are coming in for operations, or to try and give the right information. We try to engage with public pressure groups, and I know Derek's here today. We've made him submit eventually to our view of infection control. And actually what was great about talking to Derek was it was the patient experience, which he then was able to give his account of his family's experience and the members of his charity about what it actually feels to be the relative of somebody with an MRSA bacteremia, and what we can do to improve our care. We look a lot at public confidence. Of course, there's so much in the media about filthy hospitals and so on. Very important to have a clean, organised environment, cleaning schedules readily available for people to see. So none of this is new stuff. But I think, our hospital is sparklingly clean, and it does, first of all, give one a sense of pride to work there. It's clean and tidy. And also it does engender public confidence. And there are quick wins around licks of paint and so on. We have an environmental cleanliness group that feeds into the operational HCI action group. And that's estates and cleaning, infection control, matrons. And we actually all go out together and do regular inspections of areas, walk rounds, and look for feedback of the things we could make better immediately. And also, this is one of our cleaning supervisors talking to a member of the public about how we do clean. When you look at complaints that come into hospitals, a lot of it is about the very basic, cleaning and things as well. So we do try to share our experience and our systems with people. Teaching hand washing. We do a lot of this. We did manage to get some charity money to kit out all our link nurses with a little mini UV light box for training on the ward, and their job is to train 10 of their staff members, it could be anybody within the ward environment, every month, and get that back to us just as a constant reminder, because it's almost impossible to do it yourself, basically. We looked at this, and this I think is a key to our success really. It's the infection control course in-house, run by the infection control team. It's a mandatory 5-day course for our Band 7 staff, also now extended to Band 6 and Band 5 staff, as we've got 3 people. And we look at this in an action learning approach, because 5 days of do this, do that is just so boring, isn't it? So we look at, first of all, what the national agenda is, what it means, what some of these bugs are, all the basics that we need to actually be able to physically reduce the spread. And their assignment is to present a change that they will implement in their own workplace. And it can be a really small change. And one of the changes one of the ward managers did was making sure that urine bottles weren't left on bed tables, which is a real bugbear of mine. So I was really pleased she did it. So it was just a way of doing that, but using a reflective action learning approach to deal with potential barriers that she would encounter, which are surprisingly many for such a subject. So I feel very strongly that learning by reflection is very different to ticking a box that you've had training. Actually giving people proper skills and then being able to demonstrate their skills goes a long way. And of course our girls were, this is quite an unfortunate picture outside our office, they were free to leave the course at any time, honestly, but they enjoyed it. This is one of the cohorts. We also every year run this Hand Hygiene Awareness Week, which is it's a bit of a con really, because it's not just about hand hygiene and it's not all a good laugh, and it's a way of getting bums on seats for education and actually getting the message across without people realising it. And we use lots of different methods of doing that, including an infection control pub quiz, which is surprisingly very well attended, and all media really to get the message across. And it's aimed at everybody. Pinching ideas off Escher and messing about with them on the computer is perhaps more fun than telling people to be bare below the elbows. We use games, Bugs Bunny to hand out leaflets. We have a barbershop quartet come in who I won't sing for you, but they do a lovely rendition of Wash Your Dirty Hands, Don't Put Them in Your Pocket to Catch a Falling Star tune. We get hand massage people in, and it's all to kind of raise the attention bias towards hands, but it does get bums on seats. This is some artwork that we produced by getting our staff to make handprints and sign them, and then we took them and made them into a hand tree. We're currently just working on a different piece of art now, but that's displayed in our main concourse, and it costs very little to make. All of these things are low cost. We used our staff as the art as well for different displays around the hospital. Surprisingly engaging, looking at staff members' hands in glorious Technicolor. And lots of things really that just suggest fun, ownership, hands, definitely, and really kind of promote what we're trying to do.